our better people on top this our Ogbonge program where they carry Rishona every Saturday by 3 p.m. Today in another episode on top our ability inside disability podcast. And you know as they be now, they give us joy where we say and I don't gather follow sit down to take join us, listen, learn what we will get to learn today. My people, I know they alone for studio today. Oh. As you don't see today, we get plenty early birds. You will fit see Oga Boniface and Dr. Bako wey just enter house. So we ready come for now. We ready well today. How na day now, my people? How the country be? How life be? I should say on a day right well. Today now, in short, the topic for today now one beautiful topic and we no fit wait to unwrap the package. More na fit follow learn wetin we carry come today. And you know say this month we'll go back to general subjects wey dey impact people wey dey live with disabilities. You know say last month we don go back discuss all the categories of special needs and disabilities. Then this month now, last week we discussed how people with disabilities fit take live their life to the fullest with less wahala. And now this week we wan talk about assistive technology. The kind technology wey go fit help people wey dey live with disabilities to get to live life like stress free, like to live very productive life. And I beg before I call hijack the yarn today, make I allow our amazing guest inside studio. This was no be guest too. This was the co-landlord. So make I allow them, make them introduce themselves. Welcome Dr. Bako and Oga Boniface. I beg want to speak to our listeners.
My people are well done. I believe soon I don't did they wait for us for maybe 3 o'clock carry due. At least Mr. Sam don't introduce very important. So we're supposed to talk about. I bet when I listen, I believe soon I'll get to learn very many things. Especially as it pertains to assistive device for people who get 1 or 2 disabilities.
Yes, sir.
Yes, sir. Okay, my people, I dey greet una again when I'm here. Now, Oga Boniface, they talk. I remain Oga Boniface. Today, house full today, and the topic also it comes sweet. So make una just dey ready with una pen, una book. Invite another person, make he come join you. Make we learn together.
It be like say weather not too cold today, so we no go ginger push someone a carry tea. But today, one ginger say invite person. As they listen, may no be say now only you go enjoy wetin we carry come today. Call your friend, call your family member, person where you know we get pikin with disability, even person where they live with disability. Gone. Follow, call and make it come follow us, sit down, learn from the conversation we will get to share today. Again, our topic now. Assistive technology, how small tools here and there they help people with disabilities live productive life. And my people as now know this ability inside disability podcast. Now Modupe Afiz Ogun Foundation na the carry and come. Modupe Afiz Ogun Foundation don't hit hand for chest to say you see anything wey concern disability, we go spread the word. Time don't pass where we go dey feign ignorance. They say we no know now why we do like this. Everybody must know this gospel will go preach and where say it go enter everybody here. So as it be say we don't sit down now, make we begin open the passes small. I go like start with Oga Boniface. The guy don't dey look me well today. Now we don't talk this assistive technology. For people like me, where English they hard sometimes. What's be assistive technology?
Okay.
For people who get disability.
Okay. My people, assistive technology from the word assistive and technology. If assistive technology, they talk about tools or devices or things where be say if you use help yourself. Now assistive, they assist you. They help you. So any tool, device, or any kind of technology I don't know how go change that word again.
Technology.
Technology. Any kind of technology where be say you they use, they help yourself for one or two things, one or two challenge where you been get. Now him be assistive technology. Now just the shortest form, but the broader form, they very very wide because he get assistive technology for different kind of conditions. So depending on the conditions, we go now arrange waiting be assistive, waiting they help you and how they help you. Yes.
Make I see whether I go fit summarize all these Betania where Oga Boniface don't talk finish. He say assistive na something where if you use me go help you. We go assist you if you do something. And my people, as I know, disability from the definition of the word, it means say you know if you do something where you're supposed to. Imagine say on a very normal day, if you get 2 eyes, you're supposed to see with your eye now.
Exactly.
If you get your ears, in short, person they see from one side, but when it come be say you get these organs, but the organs don't they do what they supposed to. You get eyes, but the eye can't. If person they far, you don't go fit see and where if you know where something cover eye. Or person go they talk to you, go they bend ear, go on side say you know people say you say
I go repeat them 2 times, 3 times before they go here.
So you see say now the ability where the ear supposed to use hear something, you don't be affected. So basically this assistive technology now waiting tools like waiting Oga Boniface talk, tools, device, equipment, anything where we help person where they struggle with one area of ability to take catch up.
Exactly.
Now be assistive technology. For fellow people who lay like me, I shall say this one will feel somewhere. So, Dr. Bako,
Yes, sir.
as God don't carry you come, I beg, why we need bring this assistive technology and enter disability conversation? Why the thing they important?
Oh, my brother, this very one, but a very important one. Because one, for us to get one problem or the other, for us to be to see say we don't feel waka, this automatically something no correct. Automatically, if you get means way, if you be say we don't feel waka, it means they get many things about our life we will not go fit do well. Just like we talk about, if means say you need to see, as a matter of fact, there are things you need to fit do well. To navigate one point to the other will become problem. If you know if you work out to even socialize, to go meet people, relate with people, or go where you want to go, fit be problem. If you need to hear. For us to really, that part of our senses. Somehow, most of these are still things, they talk about some of those decline they get for some of those our senses. Man say you need to feel here. And some of those things when our communication will feel make you understand and for you to even be think and say, okay, see how it's supposed to be. Automatically that response they are affected. And for the first ordinary our cognition. Because if you don't think understand something or even to learn something on its own, him man a problem.
Exactly.
So if all of those things will not fit to do all of those things, it will affect us socially, physically, emotionally, to the level where we say to even attain certain things for your life. If those things no they well arranged, you know go fit achieve most of those things for your life. And individuals that not just the physical aspect, like you see say because you know if you socialize, you know if you go anywhere, you see say even you without this itself, your upbringing and your growth, personal growth, if you know go fit achieve them well.
Exactly.
It go affect you well. Socially, you go even if you dey withdraw, you say you dey like person they ostracize, person they just keep for side. Because you self, if people they go somewhere to do something, if you say you know if you go within yourself because you still be human being, because you still get mind, you feel like say you don't disturb people. You just say you know want do, even though you want do but because say you know stress other people, you know want you start dey withdrawn. And every time they talk about this thing, because if these things don't fit dey in place, we dey always say they boil down to the fact that this person will come get one. The learning problem will come there. Social isolation will come into play.
Mental health
the person
problem.
will be depressed because you know if you do what you're supposed to do,
Exactly.
and you know one see himself saying be burden to people, and he go withdraw himself. And before we talk anything, this person don't get depressed. And if he's saying life don't become burden to people, and maybe saying they feel achieve things when you achieve, you see say last night this person will to say
Suicidal thoughts, you know, they come.
So it is now make these assistive devices, they're very important.
Very
for
important.
people with their disability. They're very, very important. Because maybe just to move from point A to point B, maybe just to feel understand something, maybe just to feel see. subsequently will affect the person mind. We say the person if he choose to take his own life. So this is very important.
If it be the difference between life or death for some people.
I tell you.
If you not get some people, if it be the end of
now,
life.
as you just dey talk, Dr. Bako, now I remember waiting people wey sabi book they talk. They say you don't know what you get till you lose am.
Exactly.
And you know say most times this health and our body say you wake up, your body parts, everything. You won't carry hand, you don't carry the hand. You no go know say na blessing you dey live inside.
I dey tell you.
Because if you imagine say person dey, in one stand up go peace. In need wait for person.
Make person come carry am.
And imagine say the person wey suppose the person wey dey carry am go peace. Maybe him do something wey vex that person. The person make her see as he go peace. And it dey happen.
Yeah, it dey happen. It dey happen well. It dey happen for families.
Our people, and as I say, this conversation around assistive technology, it dey very key for this field wey we dey inside. For the fact say person don lose function for one organ, one sense, and no be the end of life. As God don put wisdom, knowledge, understanding inside mind, brain, man don begin develop some kind technology wey fit help people when get these different disabilities to still live productive life as much as possible.
And another reason we be say this we make this particular topic we dey very important be say say we don't they sing the song of integration. Of inclusion. And if inclusion go dey possible, you no go neglect the fact wey be say these people get some things wey naturally wey they suppose do but they no fit do am unto say they don't lose some kind of ability. And so the assistive devices they come in now to help them make it be say the inclusion go dey smooth. Because without these assistive devices, the matter of the inclusion, you go talk and you go see say you no go dey successful. Yes.
At the end of the day, everything we dey try do na make it be say at the end of the day, these people wey get disability go fit lead independent lives.
Exactly.
As much as possible.
Exactly.
Since now you just talk Oga Boniface, you as speech therapist.
Yes.
This one no be say we dey try fast forward wetin we get today because I'm sure say our listeners will get plenty questions for us today.
Yes, of
so
course.
make we so that
before,
anything we go bring, we go don put on top.
Yes.
So you as speech therapist, we sabi work well. If you tell us your experience and maybe one kind assistive technology where you dey use for your practice, where they work for some of your clients where get issues with speech and language.
You see, say this matter where you talk now, the importance they grow. They come to they see the importance where especially for therapeutic intervention. You know if you do therapy without assistive devices or assistive technology, you know if you do therapy where they work without that particular in fact for my field, many of the clients where I don't meet, you get so many things where we don't arrange with them. We be say this one go they help them, they do one or two with the child or with the picking where they get. Now assistive technology they diverse, they different based on the kind condition where the person get. The kind speech condition. You get some people will be saying speech or sound disorder where they get. Their own assistive tools they different. You get some people will be saying language development disorder where they get. So their own tools go they different. You get some will be saying voice disfluency. You get some will be say na different kind of conditions. And
stuttering
and the rest. So their own tools they different. But for the various, the one way I know say many people they show up, many people like our children will get challenges with autism. Maybe say they get a language problem already. They know fit understand within they tell them and they know fit express within their mind. The best tool where I don't see say where they work well na AAC tools.
AAC, I bet tell us what
That's
AAC.
augmentative and alternative communication devices. So the AAC they in two groups. You get tools where they use the augment speech, and for the idea of augmentation there be say person get speech, person get all the organs of speech when they use. When person suppose they use the talk, they walk, get problem. You understand? And he get some level of speech, he get word, but the thing not clear. And he know if you use them, express waiting day in mind. So we get some tools where we say we go introduce that client to. He go they use them, they express himself better and more clearer to people. And one of it, one na PEX board. PEX, Picture Exchange Communication System.
I put one at the year,
Picture,
especially for people where they back.
so the PEX they work with the principle say I go bring two stimuli or two things together. We go give me one response. Then with time I go they withdraw one of them, hoping say the other one where I join with them go still they give me response at the end of the day. Now when I use pictures and I use words and they help the person, it go reduce the brain work where they inside talking. Say brain work they inside speech. For me and you to communicate like this now, it gets some brain work where our brain don't they used to. You understand? Maybe say if they calculate, if they fix things already before we go talk, express our mind. So you go reduce that brain work, come make them activity based. And say many of our children they be visual learners. And they be concrete learners.
Waiting they see
and they yes, and they make them learn well. So as you reduce that thing, you can't make the work easier. They go come they do the work per se like play. As if they engage play. And now with that technique you go help them form structure of language, form so many kinds of skills where we say they delay to develop. You go help them form.
So one two way Oga Boniface don't mention now inside in AAC where you say now augmentative
and alternative communication devices. Yes.
PEX, maybe picture exchange communication system.
Yes.
And inside these PEX, you talk say most times you they combine two things.
Yes.
Where so that the picking go feel see and you go feel using hand touch arm.
Exactly.
We go reduce the amount of work we in brain go need they do making feel process
exactly
express
exactly.
So now if you can't use those pictures now they express
himself. And research don't show say children we been they use these specs where we as you they use them and you too you they model the speech. You see the two things as you they use the picture. Yes, you too you they model the thing we be saying they show you. In they learn they also see your face, they learn how to produce those sounds. And as in they do them, very soon you go see them, they go start to produce them. Yes, exactly.
You know why I talk that in my talk? You get one client when I done the work with for 4 years plus now. The boy he not get words yet. So after a while, I don't try different strategies, work. Sign language can work. As I just introduce her to sign, the thing be like the person just go on switch somewhere. Bam!
Exactly.
He grab her sharp. We can't dey flow with the sign language. But for me now, I dey use total communication most times. Total communication, I say, just they use sign, then you close mouth. You dey sign, you dey
use everything. In fact, for that AAC program, AAC device, it gets unaided and they get aided. The unaided join that sign language where they talk about now. Where we say you feel use sign language, you feel use body gesture, you feel use so many other approach.
So this thing where they try talk.
Yes.
Recently, late last year.
Yes.
Now I can say the boy man with the sign and everything, he can't they try join some kind words. I just first hear and one day they try calling name. I call him name, they try follow call him name.
Wow.
I say, not like this. The sounds where they come in short, you don't master like 21 of the 26 letter sounds.
You see.
Wow.
If they talk and nobody say once you don't flash the card, it will give you the sound. And this is not person. And the funny thing, this speaking now 10 years old.
You see.
So all this why Nothing on the come. And now, when we don't try build the speech with the sign language, we introduce the boy. It's not the come.
You see.
They come small.
Yes.
No, now true you talk
exactly.
Now,
so that's for the augmentative aspect. Now for the alternative aspect, you get some people will be say no matter how you try, the challenge where they get don't affect their ability to control those organs of speech. And so no matter how you try speech therapy, you know go help them produce speech. So they need devices where be say if speech to text. You understand? I mean text to speech, sorry. And the thing go read them. So you get so many apps like that where they use them alternatively to help communication.
On I know say ability inside disability program, na program where they touchlight the positive touch points where they inside this industry. You know, say we for this side, some of us they like see what they call dark lining for silver. But now we they try make on see lights.
Exactly. At the end of the tunnel.
No, reach end sometimes in the log. They try make una see light inside the tunnel.
Okay, yes.
So now, Dr. Bako, you know, say my people, for people who just they join us for the first time today, Dr. Bako na neurologist. In specialty now, then they come up brain keep prepared. So, Dr. Bako, inside this your own profession, I know say plenty. You don't handle plenty caseloads. You don't meet plenty people with different conditions, cerebral palsy, stroke. You know all those plenty conditions where they result as because of something we do the brain. Which kind assistive technology don't they apply for that field to support these people with disabilities?
Yeah, as a matter of fact, as you just talk, I just remember my last clinic. It was like 2 days ago like 2-3 days ago on Wednesday for my clinic. Normally, because of most of those patients, we still they for some kind of assistive device, which one of the commonest one for our environment, then the wheelchair. If other doctors they see other patients, if you work come me, they always say when I arrange Dr. Bako convoy for them. All of them they wheelchair, all of them they convoy. So most of just to say this my convoy, all of the patients go start laugh just to make everybody feel lively and everything. One of the commonest things, because when they talk about neurodegenerative diseases and certain things like stroke, cerebral palsy, multiple sclerosis, amyotrophic lateral sclerosis, all of those things they touch the brain. All of them they touch the brain. So whenever you just notice if this is touch the brain, the commonest areas where you see one is either you will stop this person from fit worker, make this person with fit worker. So following stroke, we know say the commonest presentation for stroke. Now either person will get sudden inability to talk. Person will get sudden blindness. That's why I don't tell that Boniface. I don't get patients like that. We say plenty clients say last. I go want me even work with them because of their speech problem, because they are for road they carry them. So most of them, so even if they say maybe serious injury for the brokers area where speech they come from, they feel somehow find means where these people feel talk and stuff like that. That's one of the level of inability to walk and also sudden blindness, which is also another area where we know say they affect people who get some of those disabilities. The commonest things what they use, one, the wheelchair. And this wheelchair, for our environment, the common one are just that normal manual when you sit down, if you push yourself. If you get focal weakness, again, you need a caregiver who will push you from one point into another. But then we know technology don't bring different types. They common for because most of those ones they're very costly. There's some way to use electronic devices.
They like control,
They control and just shift maybe that area, part of the body they free. Then if you just move and right, you see the thing go turn, push red, maybe until you must use manually they do it. For some people even then get paralysis for both hands. Say person will get one they call amyotrophic lateral sclerosis. Where you say there is heightened from your vocal cords to your muscle everywhere. Maybe not only the brain they work. That's if they see only brain the world. Get ready, they fit connect all of those devices from the brain. And everything. How you go if you think You see that your thought will appear for
English.
and the voice this way. Thank
you. Remember one Steve Hawking?
Yes, exactly.
Like, yeah.
This one called they call ALS. Amyotrophic lateral sclerosis. That very problem will affect all of your muscles of the body. It will start all those motor area to the even the smooth muscle all go there affected. So all of those technologies they work, but for my own training because of Nigeria technology.
We they come.
Maybe
So
go reach the end of the tunnel.
We don't get light, small, even though that touch light.
So another thing again, I mean, apart from the wheelchair, at least other devices for help them for workout also. Like some people they feel use Siemens frame. You see some that frame we get tired from with 2 legs. The person if you stand, they will push and
crutches.
If you move. Subsequently, some they will use crutches. Some going to use cane.
Yeah.
Depending on the at least the stage of their improvements and stuff like that. Because I know we don't get plenty cases where you say you will see patients. With some of the patients that go discharge them, don't know if you swallow. We see them with NG tube. You know, you get procedures so they're supposed to do for them before allowing them to go with NG tube. But because if we don't weigh the whole problem, most of them would rather say, allow me NG tube, my go they come back hospital because they don't if you swallow, so you have to feed them through tube.
Exactly.
So go with wheelchair. You see somebody come out of testing and they don't feel swallow, you try. Being the doubting Tom also will be for our field. We'll say you must swallow for our from Moses say you no cough first. We'll give you enough things, water, maybe swallow. If you no cough, we'll say okay, we'll come out the NG tube. That's nasogasic tube where they put for nose go belly. So that feed somebody. If one come out you say they'll go with their wheelchair tomorrow. You say this person will come with you one Siemens frame or something or crutches.
It don't they progress
because one thing you go emphasize with them, don't ever get tired with physiotherapy. Try to do this rehabilitation and everything. I can guarantee one if you say the person come one walk is
stay for long, you go
push the weight like this to one side. So that many person don't get bed sore. Because bed sore on your own.
Now
physical disability. Now one thing where they even kill people more than any other thing.
Yes.
So because if you get one wound, they're very difficult to manage. You understand? So some of those things also they use them for our patients.
Hi, Dr. Bako. Thank you very much.
Thank you very
much.
Be
small you know, as we talk about this bed where this air bed where they change help person change position. Now you know all these newer models of cars now. These their Benz, their Range Rover. And you go enter the seats man go the massage. Even your back self. If you turn up to office.
I will tell you.
Yeah, and you know say the rationale I don't call speaking English. The reason why we they really push this assistive technology and say as human being if you feel stand up do something for yourself you want drink water you stand up carry water drink no be small confidence joy now they give you imagine say you sick now you dey on top bed you want drink water and a person go carry and come dey put am inside your mouth you go drink the water but e continue 1 day 2 days 3 days almost
1 week
even if na stone dey your heart you go begin do you one kind you go begin do you one kind so we dey try restore some kind dignity give this person to the person yes and abeg our people I sure say una don dey follow us since we start today episode abeg if you get any question or maybe person wey dey on site dey follow you lis ten get question abeg una dey drop am okay I don see a few but more na continue dey drop the questions we go begin attack the questions one after the other cool now inside this assistive technologies you know for every condition I no sure say e get condition wey dey where assistive technology no dey from inner ear na the wahala start cochlear implant once dem don do that surgery put that amplification mechanism inside your brain next thing you don begin dey hear I get clients one smally like that I know speech the e too sabi book but you know say when e come reach areas subject areas wey be say language full you need talk you need of course na wetin you hear na you go talk na late last year she come benefit from one free hearing aid program Now the girl was on the come where in short, if you near their if you did their street now her voice you go there. The way she just talk come up from shell. You understand?
Exactly.
Now she hear the words don't begin the sound more and more like day-to-day communication when
because
me and you
she
don't
dey
hear.
hear.
Now, for people who get visual impairments, they say something do their eye, something do their ability to see. Even glasses where person go carry wear, we go help you see
Na
where.
assistive
Na
device.
assistive, it dey help. Na help you dey help. And when you wear and you will see where.
Yes, exactly.
You will see. And your life don't better because of that thing. Also for people with visual impairment, it be like last week we discuss a few things we follow join this assistive technology. Now just say we don't give a name. We don't give a name. So you see, say for people when get this visual impairment, then they hear now, so they go hear, they go feel respond with their words and everything. But when you come place where they need write or read, braille. Now what they use? Then go learn how to use braille. They communicate, and for some of them too, then they use all these FM recorders, recording devices.
In fact, these days, if you get app where we say we they promote now, this Be My Eyes app. They use them, they help them to navigate around a place. You go see, if you see person where get visual impairment, if he move from one point to another, he no go even cause any accident.
Thank you.
He go they move, and the app, the person where they for the voiceover there go they tell them waiting they see. They direct them, go left, go right. This, and they tell you very wonderful assistive technology.
Yes. You see, as it is, just they make life easier.
Exactly.
For people when get where they live with disabilities. People when get learning disability, maybe say you own and say they struggle, maybe dyslexia now, they struggle to read. But if you talk to them, you understand everything. Like what your guy Boniface talk earlier, he say text to speech devices there. So in short, this one, your normal browser, your Microsoft,
yes, they get text to speech now.
Once they use Windows 11 or they use normal you subscribe, use paid version of Office suits and everything. All those functionalities there. In short, now, for instance, nobody say they sell anybody market. Microsoft now, they build Windows 11 with accessibility for mind, for people of all abilities. So person will get visual impairment, the speech to text function, it just now shortcut key say we go use. For any app, you no go even need go download software or anything. You go just press the shortcut, then begin talk. That's how you go to type up, and it go help you do punctuation, do everything. Come out and check. So these tools, they don't dare say, I beg our listeners, as much as possible, if you get person or you man a person where they live with disabilities, I beg now no be time to fight advancement.
Exactly.
No be time to fight change. Now to embrace them, because these things we don't they come out now to help improve everybody quality of life. Dr. Bako don't finish work for people who get physical impairment and the people where they enter in clinic. I shall say injury be like prophet. Nobody they go see and come out the same way. Same thing with Oga Boniface. Now, person don't ask question. He say, what are the steps? What will be the steps in where they involved with introducing PECs to a learner when gets communication difficulties? So this question don't they call person name?
The question.
Oga Boniface.
Okay.
Make I read that again. He say, what will be the steps where they involved in introducing PECs to learner when gets communication difficulties?
I for don't tell you make you chat me privately because this one now don't they enter another level because that consultation. But we go share one or two. PECs they for like 6 main stages or phases, and each phase, if you bring the child, you get entrance and you get exit. Each phase. Each particular phase where you go bring the child in, you get way pattern or technique where you go follow, bring the child enter that phase and then exit that phase to the next phase. So first of all, you go learn to introduce that particular pictures to the child. as you dey introduce am, e get another technique wey be say you go need to help that child to dey make request with those particular technique. 6 main phases, but I know one because e go chop our time well to break down these phases, how to enter and how to exit, because na wetin we dey do for mostly our seminar programs and then training programs. But I just want to tell you, the phase 1 be say you go teach the child how to make requests. You go introduce the pictures, teach them how to make requests with them. Then stage 2 be say you go the backward chaining. For that phase 1, no, we never come up for phase 1. We get stage 2 for phase 1. And we get stage 3 before we go start to dey comot. So e get techniques wey be say you suppose learn from a speech and language therapist wey go help you introduce specs. But the first stage na simple stage. You go first introduce these pictures, build picture library wey be say that things of the child, wetin the child suppose dey use, they tell you, see wetin I want. Make that child start to dey use those things to show you
wetin
wetin
you want something. Maybe they cry or they point or they shout, you bring am back, say see this picture, show me which one.
Yes, you go dey help am. And if you notice say na water wey you want, you go take and go that picture, make him bring out that picture of water, make him give you, and then you go model wetin you want, make him talk. You understand? As you model am, first of all, if you fit build this foundation, then other stages go dey simple.
Oga Boniface, you see wetin we go do for this thing. This questioner, you go send message, give Modupe Afizogun Foundation.
Okay.
Through, how did they do that in that year? They go say, to so and so person, through so and so person. I should say, you no be bad person. Everybody who did this studio, very
organized person.
so I should say that listener go figure better response. I know so you don't try well. To say we get all day, you for don't day you begin the teacher.
Bring the thing one after the other.
But they not do pass. So I hope say Oga Boniface don't fit attempt your question. Now, Dr. Bako.
Yes, sir.
You know, this one, no be only me, the film. I know say I chip am in small when I talk about the importance and why people need embrace this thing. Now, you get plenty people where they fear is say anything, say they won't go bring device, they won't go, they go just, hey, I don't want here, I beg. Maybe they don't the reason say, Kai, no be small money, you won't call you, or who go they teach this person, or who go they use them. How you they take encourage people when come your clinic to embrace or to even use this assistive technology? How? Because some people I know say maybe you go need even use some kind of force for some kind of people say if you not buy and we know they come up for you.
Because a matter of fact, because most of them, because you don't dare to do this thing for a while, but then do not understand. They'll like say maybe I want to disturb us, say we must get this thing before any other thing and stuff like that. But then we understand what it means. Say, person if you move, get device so if you make a move from point A to point B. Say if we are not there, ourselves at least, you know, contact all of our life down. At least if you climb, with small support, climb in wheelchair, go even move, go kitchen, open fridge. Just the way they give examples. Say how can every time you lie down to drink water, you have to call somebody give you water every time. If you reach a particular time, you say go tired. You understand? But if you get that, if you move, wheel yourself. Go fridge, get what you want carry for fridge, come out, come back, and stuff like that. Will yourself go outside. You understand? Sit down, look, trees, beds, the chair, and everything. Then subsequently enter inside. Then 2-4-7 make you do on top bed. Because now what it means say for somebody gets stroke, when if you work out, if he raise himself, if none of these things are available for him, it means say he no go feel water. Do you know what it entails? Those way we carry talk and things. It means say this person they prone to depression. So most of the time for our hospital, we don't see say okay, this thing now waiting will take time. We will say Alpha, when I try get a wheelchair before we discharge you now, so that at least if I don't get wheelchair we discharge you now. So then they just say no. We'll go tell you say directly emphatically sometimes because we know see now for the patient to the worry for. So say if we don't get wheelchair, no discharge. And then because most of these cases they will don't take for hospital. most times because one, the recovery will be very, very slow. So majority of them don't stay for hospital. Let me say, if then CCO don't try all the one with it will last. Because even them will want at least change environment this time around. Because we don't observe, say, somehow when this person then allow him go home, go the environment they used to. Then for hospital, if he dey hospital, somehow, one person if he die, psychologically they will cause problem for inside the ward and stuff like that. Most of them, their recovery, they much more optimal when they go for familiar environment, where then they used to. If you navigate, even like say their eyes they close, because then they used to that very environment. So we'll come try to small, this kind of subtle threat, so if not know by wheelchair, I let it go out. Because one, we get our patients
interest.
That's after when we already try explain. Now only when my explanation no dey good enough, we go guys. Then so if we not do this, we not go house because when we know what it means. Because all of these things go a long way in helping the recovery of that patient. And again, all of those say, you know, for stroke management, using stroke as an example, we get acute complication of stroke and we get chronic complication of stroke. And so those chronic complications now they try to say more to avoid. Because if you don't continue the rehabilitation and physiotherapy, the person will get contractures. So maybe say the area of weakness will come get worse. Maybe say last it still feel no come use the limb very weak. Then number two, because if you move from point A to point B, just like we talked about the other time, post-stroke depression is another thing. If your mind is defeated, or it means you don't have depression. If your mind is defeated, the body not going to do anything. So if you're dead in the mind, I can tell you that you will not heal physically. So this is a post-stroke depression, another complication what they get. They're all of the bed sores, because if the person, if you move from point A to, if you leave your bed, climb wheelchair, if you wheel yourself, go parlor, go sleep for 3-seater or go sleep for normal 1-seater. You say you change position, that still prolong for one. So it's a bed sores by the patient will get. So these are all of the gains we feel come. But most times, man, we are after counseling or talking to the caregiver, even talking to the patient. If they don't agree, man, last we do subtle threat where we say if you know, we won't do like so we're imprisoning you. But then we know say that you're right to leave even if you know if you buy. But last for some people we still they adamant. We no agree, that's why all of our explanation. Hospital no in prison. But we'll try all our modalities. Like when you know work, with those hospitals no in prison and the person get right to say no one use them. But then we'll try only when against medical advice. We'll say, okay, since I so it be, we'll allow you go. But then we make them understand the importance, which is the most, so that they will make informed decision as to say this thing is important, and if they don't get them, see things will happen to this patient.
Dr. Bako, just make we chain am with this thing wey you don talk now. You know say e get as you feel person come hospital or maybe dem convince am finally come hospital. After or sometimes they bundle and come. As you can't run the treatment, you can't say, okay, this medication, then you go use this crutches. The person feel you don't ever experience person will go use maybe religious this thing to say no, say you know they do like this, so say I they take deal with those guys.
Like there is some people where they say they don't believe, they'll tell you say they are God. They are God for your ambulance. When nobody too worried like that, say they believe in their God and everything. I'll come after I don't bother the person, because most of them, these kind of people, because of their kind of mind, their kind of temperament, most of them are born to or then drag them. Then you go just come making just proof points. And since when so might just come to fulfill our righteousness, like say. Thank God for our training. Ever we will try CC at our own level, do psychological
reason with
the person, make them understand. You know why you can carry come here. You think say these people carry come this hospital that hates you. All those people you think say by now even in their house they sleep. If you know better for them than make them carry come.
Exactly.
Meanwhile they come here and they even waste almost 2-3 hours before
spend money join.
You think say if they hate you, they go do all of those things. So you try bring the patient, may work with you, then they reason with you. So although people hold too tight, means how the thing don't make sense. Or it's very stupid. So I can understand something people know hate them. Even as in a ban on that, you tell them say if it means they you call even if they're Muslim, you find some examples given. If they're Christian, you will find some examples given. Where we say we in tandem with all of those things. Is okay, maybe I say really think therefore, if a Christian person there's a faith without work, they say faith. Of course, say, do you know the work part of the faith without work when they talk about? Do you know the work part waiting in e cover. That work part cover plenty things. That work part fit be physiotherapy. That work part fit be say make wheelchair. That work part fit be say make whole cane.
Make it swallow medicine.
Work part means say make swallow medicine. That work part say even as you swallow medicine, nobody stop you to follow your God.
Exactly.
You understand? I say, and we don't observe say both religion and science, medicine. If they combine two of them by recovery, they better pass.
Exactly.
Person carry medicine and faith join together do better than person carry only medicine and person carry only faith. You are worse part than person carry only faith, sir. Because you need to combine both of them, they work very well. So we dey always try to do. If we say we try at our own level, also maybe psychiatrists or maybe behavioral psychologists, you know what for us, we dey refer them to go see a psychiatrist. So that because those ones get extra modalities where they can apply for these individuals. And if you, for psychiatrists, one thing I like them, if you don't try not if you say they go, no mind, bring your pastor, come. The next meeting you carry, your wife is there in a person you marry, or your brother is there in a person you marry. They will fit to say your next visit, I beg come in with your pastor. They will talk to the pastor. Do you have the pastor's number? Those people why I like, they will even call the pastor. If you know if they are, they'll call and put for speaker. Then start engage, start talking. Then so that maybe you hear.
Make yourself
So that maybe you
sit where.
Maybe you carry your mind, your eye, your everything carry look good. Say this is what everybody they do. Now because of say they want help you.
Yes, so
even you carry that religion for head or not, maybe you know say last, even the medicine, all the methods where doctors they used to do. Now I believe say na through God, all of which they do, we try to get all this.
Yes, now.
You get medicine we carry from space come. Who build this world? Who create this world?
No be God.
So anything they pick from this world, now what God give us for this world, who carry help people. So last, if I give you drug, may know so that God they give you drug.
Exactly.
And the idea be that.
Gone are the days where you go ignorance go make you die for something where people they survive.
Exactly.
So people want to hear person don't ask question again, and this one the way it is started, I just know saying Dr. Bako, he say from a medical standpoint, does PECS accelerate speech development in children with autism, or does it delay natural speech acquisition by creating reliance on non-verbal cues?
Might talk before maybe
Boniface
will add. Because see, for every neurological problem where people they get, before they go even bring any modality for you to use, they must not assess you, put you at a particular level before they go say, okay, this is not the modality we will feel use for you. So anything we start with, if they say this is where you did, you know, means say maybe okay, just imagine they remove the PECS. There's high tendency you will just remain for the same place where you did, based on the assessment. So before they go use any modality to help you, it means that they don't try to put you for one level the same and without this program. So you know, be like go retard you. So we don't diagnose you, put you a particular level, mild, moderate, severe, before they think of what they go do. So make you not get any fear. You not go make them go back or maybe go delay them from trying to talk. Now what would also say, based on our assessment, this one go hard. Before they will fit us, okay, then this is what we'll do. So no fear. The PECS no go withdraw the person, you no go make them go back, or you no go make them not achieve speech at that time. We already see now hearing the so even without the PECS, you no go work so that the PECS will have that time before we go put the person.
Dr. Bako, thank you very much. Make a no still Oga Boniface. Jump on this one.
Exactly. Oga Bako don't talk the truth. Waiting the person need to hear. You see, before we even begin to introduce intervention, we go do assessment. And like I talked earlier on, I say depending on the various kind of condition, speech condition, you get different assistive devices. When I don't assess your child, come find out, say this child, he get challenge, he need augmentative help. Wey be say if he no use that device, e go dey difficult for am to learn some certain skills. You know, say language dey wild. Under language we get syntax, we get pragmatics, we get grammar, we get plenty things wey the child suppose learn before he go start to dey use intelligible speech, dey talk something wey person fit understand. So if we come check say kai, we don't check this child, he get few words but he no fit use am, he dey use am scatterly, he no understand wetin dey talk, and he no understand how to relate matters. We go suggest okay, use specs. And like I talk, Specs, they don't do research on top specs. Come find out, say people wey been dey use specs later as they use them consecutively. You know, like I talk, say they reduce brain work. They reduce the cognitive work wey dey inside the communication. You go reduce and make am easy for the child to access. So as you dey do that specs, research don show say e dey help the child learn the words wey you dey model to am. And very soon as you dey withdraw the pecs, because the get stage wey be say you go dey withdraw the pecs. So as the child dey use the pecs, use am. If you see say dey improve, in dey try use speech, if you start to dey withdraw am, you go notice say e dey help am more. So the thing balance.
Oga Boniface.
Yes.
See, this thing when I talk, not be only on top this podcast. You need do master class. We don't get some kind comments and questions again. This one now, Pam the quiz. I hope I never spoil this name.
Oga Pam quiz.
Oh yeah, he say correct people when they give us correct knowledge, when they help us carry everybody when get one form of disability or the other along. Technology now one antidote we don't come to address most of these issues of exclusion. Because anybody when get disability challenge won't express themselves. And then they find it difficult to do so. It cause serious problem wey fit lead to depression. But what be the process of counseling people to accept their present condition, to adapt to the use of tech assistance? You know, say this question, better question, and I don't already try connect am to wetin Dr. Bako don dey talk since. And even as we dey inside here, we don't mention that everybody don't shook mouth on top this and say, Omo, these specs now, this assistive technology. Now something we go fit help anybody when you get disability may attain a decent level of independence, go fit do things for yourself. But this question directly in the ask whether within be the steps, the strategies where you use take counsel these people. Dr. Bako, you go feel shook mouth for this one small before we carry on.
This very part like one of those things we ever as a resident doctor, even before you become what you're supposed to become, there are stages of counseling.
Just psychotherapy now.
You understand? It gets stage where you go. First of all, you will just when you get to meet the patient, you can sit down with them, talk to them. Say how you doing, how are you doing, and everything based on what you are engaging for. You sit down with them, talk to them, say, you they comfortable? Say only me and you interact, or that maybe you need any family member to sit down with you. Make the person they relax. Make sure so the environment no they tensed. Making them relax very well. Make calm down. If you sit down, if you need anybody, you tell them, call anybody. You want me to sit down with so that I'm gist. It's just like any other cases where, like for medicine, they say how you want to break bad news. Okay, let's say person come with sickness, you can't go, something you can't go diagnose, can't say na cancer. You have to follow stages. Now similar thing with for every case. Then they comfortable for better place where it makes sense. They say you want tea. Okay, you want to ask the person how far you know waiting be this problem, waiting and tell you say be this problem, or what you know about this problem. So that may you understand how far the person know about this very problem. You allow the person, they may give you one idea, give you one insight as to that very problem. If you finish again, there may be the places where you no gets to understand that. Then you, because you have a superior knowledge based on your training, then you can put one or two things together. Yes, you tried very well. You see, say this thing, CIB, you can add some information to that. Again, you can't say, well, you still very okay. Even that's why I discussed with you. You still engage and tell them, say, you do okay. I be you want rest, I be more control.
Exposure therapy.
You want rest, I be more continue. You saying they were okay, you're okay, right? At least, and you say they talk, you say that, I say, but you understand with this level of what you try to talk about, I say, why this thing is very important, you get them. Then you can go in depth, then now bring the person at par with you, make them understand this thing, and tell them the pros and cons, tell them the importance. Why you reduce that so, and you will look the person face, they try to understand at least all those non-verbal cues for your face, whether in on the tight face, or they look very, very. when they look very, very lost. If you say they look lost, or you know they vex, or you know they get the thing, you can't pause too. Are we still together? Can I go ahead, or you want rest? And everything like that. You must at every point in time
they check in.
all of it. They check out whether they una dey together.
They touch her, you can see the body on the wall.
So you have to always be doing that. So these are the stages you keep talking. Like if I for say breaking bad news when people get cancer, you go fit talk to the person halfway. Tell them say we're gonna meet later or meet tomorrow. So that made the person they assimilate, try make them understand what. So even for managing disability and any other this thing, not similar processes for people where they find out how to accept the situation. They go piecemeal by piecemeal, trying to make them understand with each stage of the discussion. Tell them the pros and cons. If you not doing like this, waiting fee happen, you don't understand read level, but if you doing like this, see how the positive side of the whole thing and everything. So most of these approaches, now so you will do them till the person get
tobacco,
well informed.
You don't finish work. You don't finish work. You know the reason why they smile. Recently, they don't do me this thing. They won't break news, give me inside hospital. They walk out to. They say, I beg, we see you. They carry me come up from everybody. They say, make we go sit down. Now they begin talk. They talk. The other doctor, they follow full mouth. There are some point. I don't think they look there, they smile. The doctor tell the other and say, Kai, this guy they do well now. I don't need to hear. So I understand perfectly what they saw for you.
Yes.
I should say this one go fit help Pam the quiz. Now one sharp question before we trust in our cutting. It's too cold for you. Before we close up. This one. He still get problem with this specs, so but I like the way they go about Boniface. He say he specs practical in Nigeria, where teachers often have large classrooms, or does it become unrealistic because individualized attention is needed, or individualized attention is limited? Make a shook mouth sharp for this one.
Exactly.
Since a of speech therapist.
Exactly. Now, within
the regular classroom teachers no get the know-how.
The technical know-how, unless they are trained.
They are trained. And, you know, in therapy, most times, except say na social skills program and the rest, therapy na mostly one-on-one.
Exactly.
And during those periods, they go fit teach your pikin all these kind of things. But after they don't teach them for therapy room, to achieve generalization, make it be saying go fit transfer and go other environments. Now you go introduce the same strategies given class teacher say, okay, see what you they use here, or see what you they try teach them. So that inside class, if the pikin won't communicate, now picture we will still use. So the whole idea say, if you know they practical for Nigeria, and you know personally, I feel say. We get different understandings for this thing. Oga Boniface, in 1 minute, then this in 1 minute, I beg, jump on this one in 1 minute.
Okay, you see,
practicability
of PECs. Yes,
Nigeria.
If you talk about practicability of anything, you go also touch the financial implications. You understand? And you see, everything get financial implication. And to use specs where if you want to use them where you go take out time, because now pictures we they try exchange words for pictures and words plenty, which means the picture go plenty. You understand? So the challenge we will get now for area of that financial implication, the challenge we they get now area of getting the speech and language therapists we go there around to pass the knowledge to the various paraprofessionals. You understand?
So, you see this thing?
Yes.
Hold that thought. Hold on. I shall say this month's question and answer session. You go too sweet.
Of course.
For everybody who don't participate today, and you don't hear something we be saying, maybe we don't answer them, but still they do you one kind. You know, as you swallow sweet potato, then water go hang somewhere. Hey, you go find water. I bet if the thing hang, you go just be with us. During question and answer session for this month, the whole day we will sit down. We go do more justice to everything what we don't discuss so far. So our people, it's with us where we say on a day with us, we don't see the participation, the questions, the comments we don't come inside. It means that they listen to us, and it's with us where we. It means say we they do something right. We means every Saturday and so people go they join us. And I thank you. And we no fit wait to see on next Saturday. I beg Dr. Bako Oga Boniface more na use an amount tell our people, our very good people. Bye bye.
My people, now well done. You know, easy to take your data and even at least listen to this program all through. And I believe so. And I know say this program somehow they very enriching, and somehow even maybe to you directly, you get the way you go carry them assist person way they close to you. I also now go join us next week. Thank you very much.
I want say better thank you to our people where they listen, where they ask question. It shows say they follow us. You understand? It shows say they write note, they take notes, they take down things we they talk. So I want to appreciate una, and I want make una do more. Like to invite another person, we be say the person need to hear within you they join here. I still remain Oga Boniface.
So you don't talk about
You don't call me back.
Some people, welcome. My name na Ini Sam. I be special educator and autism specialist. Till next week, more na dey well. Bye bye.